Location, legislation, and legislators. Welcome to this microlearning session. Nurses are the most trusted profession and are called upon to give testimony in matters related to healthcare, health policy, and nursing practice. Imagine actualizing the power of nurses if 4 million U.S. nurses or 10 to 15,000 Vermont nurses identified healthcare issues on the website, communicated with their representatives weekly or monthly, or joined a healthcare board, coalition, or advisory council. Imagine if another 400 nurses joined ANA Vermont to amplify the voices of Vermont nurses to shape our profession and improve outcomes for patients. I am passionate about healthcare policy and nurse advocacy because of my 35 years as a nurse practicing in Vermont, Maine, and New Hampshire, 25 years of which has been in the role of a RN case manager. I have assisted patients, families, and members of the healthcare team navigate the United States healthcare system at the front line. I have experience in the emergency room, in acute care, and in the community care setting. The barriers and challenges from prior authorizations, denials, health disparities and equities, staffing crises, safety and quality concerns, and outdated onerous healthcare policies led me to pursue my MSN in healthcare policy at Chamberlain University College of Nursing. The goals of this microlearning are to increase nurse advocacy, increase knowledge of legislative process, and increase participation in healthcare policy. In short, this session will cover the following objectives. Locate on the ANA website where the state legislative activity is found. Locate on the website where federal advocacy is found. And locate where the Vermont General Assembly website is and how to find House bills, Senate bills, and what the legislative priorities are. And also get a level of confidence in contacting your legislator about a healthcare policy or a professional nursing practice concern. ANA Vermont. Notice the red arrow pointing to legislative activity. Under this tab, you'll find some of the legislative activity that ANA Vermont has followed and provided testimony for. The tab to the right holds ANA Vermont resources, one of which is a section called Betsy's Briefings. This resource is a short synopsis of the legislation ANA Vermont is following. It'll be discussed further in other more microlearnings, particularly in an interview with Dr. Betsy Hassan, our ANA Vermont president-elect. ANA Vermont has many resources on this website to help carry out its mission and vision, which is to advocate for the nursing profession, health for people in Vermont, and affordable access to quality care for all, and also to inspire Vermont nurses to advance the nursing profession and the health of Vermonters. ANA Vermont has 400 nurse members out of the 15,000 nurses in Vermont. ANA Vermont represents all nurses in Vermont and can educate and mobilize more nurses participate in the legislative process to shape and lead healthcare policy. Salvin and White relay that it is important for nurses to learn how to do advocacy work to support the profession and positively impact healthcare outcomes. ANA and federal advocacy. ANA believes that advocacy is a pillar of nursing. Nurses instinctively advocate for their patients in their workplaces and in their communities, but legislative and political advocacy is no less important to advancing the profession and patient care. The ANA mission is to lead the profession to shape the future of nursing and health care. ANA is the voice of all the nurses in the United States and is always at the table where policy concerning healthcare or nursing practice issues are concerned. Under the Federal Advocacy tab on the ANA website are tiles to select and discover further what legislation and advocacy work is being done for nurses by ANA. It is quick and easy, and I recommend that you get to the website and check this out. Moving to the Vermont General Assembly, the Vermont Legislature. On our state website, notice the two red arrows. On the top ribbon, this is where you can select bills and resolution, committees, find Vermont laws, the House, the Senate, and more information about the State House and staff. The lower red arrow shows where you can search for your legislator, which will have a hyperlink with their email address. And that is how you can simply send a message to your legislator sharing your support or opposition, concern, and data about an issue. On this next slide, the red ribbon shows where to find information in the Senate, where a bill is, in or out of committee, perhaps on the wall, which is like a parking lot item on an agenda, sometimes worse, meaning this item may not get to the committee to discuss. This section also has bills vetoed by the governor. This slide shows the House Committee on Healthcare, and the arrow directs you to the current members. This committee is one that ANA Vermont and those of us passionate about healthcare policy like to follow. You can join in virtually to committee hearings or be invited to sit in the committee room if space allows. Simply clicking on the blue highlighted area will connect you to the members page with a link to send a message. Go ahead and try this on your own and tell them that a microlearning session from ANA Vermont directed you to do so, or share your thoughts about a concern or issue you have. Let's find some of those acts and bills that are priorities for ANA Vermont that Dr. Betsy Hassan, ANA Vermont President-elect, and others have been following for us. Act 24 is an act about crimes against health workers. This act is found under the Acts and Resolves section under Act 24, shown here. ANA Vermont is following up on this act to be sure that it becomes an enforceable policy to keep healthcare workers safe from physical and verbal abuse. This act was passed last year and is currently stalled in the Law Enforcement Advisory Board. See Dr. Hassan's comments regarding this on the ANA Vermont website. H-171, Adult Protective Services. You can see it here under Acts and Resolves. ANA Vermont was instrumental in shaping this act to be sure Vermonters were protected, as well as healthcare workers, regarding the definition of negligence, for example, medication errors, and how it is reported, and the importance of maintaining a just culture in healthcare. Federal advocacy work. In early April of this year, ANA Vermont placed a call to the Federal Office of Management and Budget to request a regulatory change. I was invited to listen in on the call and heard the skilled advocacy of ANA Vermont. ANA Vermont and other stakeholders identified that skills testing is unique to the LNA role and creates an additional burden to those trying to enter the healthcare workforce. Other licensed healthcare workers do not have the same requirement. Testimony and a solution were shared. Quote, removing the unique requirement for nurse aides to participate in skills demonstrations so that their entry to practice can be harmonized with other nursing professionals. 42 CFR 483.154E, successful completion of the competency evaluation program. The state must establish a standard for satisfactory completion of the competency evaluation. To complete the competency evaluation successfully, an individual must pass both the written or oral examination. ANA Vermont 2024. So follow-up on this advocacy work and how the OMB and the state of Vermont will respond is underway, but this should make it easier for healthcare workers to become educated and to get into the field of healthcare. The top legislative priorities of 2024 for ANA Vermont are prior authorization, data privacy, and protection of healthcare workers in the workforce. Go to the ANA Vermont website and learn more about it. Nurses have an ethical and professional responsibility to learn about healthcare advocacy, participation in legislative work, and professional associations to support the profession and the impact of healthcare outcomes. Knowing how to find healthcare policy initiatives and legislation on our professional, federal, and state websites is key to successful nurse advocacy. Utilizing resources from ANA Vermont website and attending events like Vermont Hill Day and the learning opportunities offered can help you advocate for nursing and health outcomes. Advocate. Be brave and contact your legislator or congressperson today. You know how to do it. Thank you.